Hi guys, in this video we're going to talk about the anatomy of the thoracic wall. Now, what is the thoracic wall? It's basically your thoracic cage. It's basically where your lungs and hearts are well protected. It's formed of the ribs, your sternum, and posteriorly your thoracic vertebrae. Now we have true ribs, we have false ribs, and we have floating ribs. And it's very important you guys know them from now, because proceeding into that video, we're going to see why do we have typical and atypical ribs, and why do we have typical and atypical vertebrae. And without understanding the basics, it's going to be difficult to relate the information later on. Now, why do we call them typical ribs? We have rib number 1, 2, 3, 4, 5, 6, and 7. Sorry, I meant why do we call them true ribs? Because they are connected to the sternum by costal cartilages. All right, so each one of them has its own costal cartilage that makes the rib to connect with the sternum. However, the false ones, they are ribs, yes, which is number 8, 9, 10. All right, the last three ones, they are connected, yes, to the sternum, but by the costal cartilage of number 7. So if this is number 7, all right, so we have here 1, 2, 3, 4, 5, 6, and 7. Each one of these 7, they have their own costal cartilage. However, 8, 9, and 10, they indirectly attach to the sternum by the costal cartilage of number 7, forming this costal margin. And the last two are actually floating ribs. So number 11 and 12, they are floating ribs. They do not attach to the sternum anteriorly. Okay, so it's important to note here that we have an angle. It's basically the angle of connection between the manubrium, because this is your sternum. The sternum has manubrium, it has body and xiphoid process. Okay, so we have a joint here, which is the manubriosternal angle here. This angle is very important. You guys can feel this on yourself. If you have your jugular notch here, below that you have your the manubriosternal angle or sternal angle or angle of Lewis. It's important clinically because at that point you know that this is the attachment of rib number 2, and from here you can start to count your ribs. All right, and that is important for anything related to the lungs. Insertion of chest tube, you want to put it between the 5th and 6th costal cartilages, like we said in the previous video. Anything, any landmark for your heart, any procedure, the angle of Lewis is important landmark because this is the place of the attachment of the second rib, and from here I can count the ribs. All right. Now moving on to talk about the thoracic vertebrae and talk about the ribs. We have typical and atypical thoracic vertebrae. What are the thoracic vertebrae, the typical ones? It's starting from T2 to T8. So guys, remember that T2 to T8 are typical thoracic vertebrae. We're going to talk about the vertebrae first, and then we're going to talk about the ribs later on. So 28 is a magic number. Remember that 28 is a magic number because this is the typical thoracic vertebrae, okay, from number 2 to number 8. Okay, now what about the ribs? We can just add 1. So for the ribs, rib number 3 to 9, they are the typical ones. Okay, so when we say typical thoracic vertebrae, what do we mean by that? It means that we have a body. Okay, we have a pedicle that connects the body to the neural arch, and then I have the transverse process and I have the spinous process. All right, so I have transverse processes and I have spinous process. So if that is a top view and this is my body, I have pedicles that connects to the neural arch. Neural arch is what surrounds your vertebral column. This is the spinous process. These are the transverse processes. So these are the pedicles. All right, this is your body, and here is your vertebral canal. Okay, and you have laminae, right and left. transverse processes, and spinous process. Okay, now typically we would find the thoracic vertebrae, they have a spinous process directed downward because this is limiting the extension. The extension at the thoracic spine, you guys, should be limited because we don't want to over extend our thoracic cage, because here we have vital organs. All right, so this is a typical feature. Another important feature of any thoracic vertebra, why do we call it typical, is that it has a superior and inferior costal demifacets. These are going to be for the articulation with the ribs. Another thing is that they have a costal facet on the transverse process. Okay, so we have superior and inferior demifacets on the body. We have transverse costal facet on the transverse process. It's directed downward, the spinous process. Okay, so these are the general idea of any typical vertebra, thoracic, of course. Now, when we talk about an atypical one, all right, why this is back? If we talk about the atypical one, it's gonna be T1 and the last thoracic vertebrae, T9 to T12. Why T1 is different? Think about it. I want you to know one important thing before we think about it. It's that each rib articulates with the corresponding vertebra and the vertebra above. Each rib articulates with the corresponding vertebra and the vertebra above. So if that is your rib, it articulates with the same number of the vertebra and the vertebra above, right, by its head and tubercle. So for the ribs, we have head, we have neck, we have tubercle, we have angle, and then shaft, and then the costal cup, all right, to articulate with the costal cartilage anteriorly with the sternum. Okay, so we have joints between the ribs and the vertebral column or the thoracic vertebrae. That joint is one between the head of the rib and the body of the vertebra, and the other one between the tubercle of the rib and the transverse process of the vertebral thoracic vertebra itself. So the one between the head and the body is what we call the costovertebral joint, and the one between the tubercle of the rib and the transverse process of the thoracic vertebra is what we call the costotransverse. Costo means rib, vertebral body, costotransverse, costo is rib, transverse is a transverse process. Okay, again, let's look at this picture. This is the body. All right, I have a rib. The rib has head, followed by neck, and then tubercle, and then angle, and then the shaft, and then the costal cup that accommodates the costal cartilage. Now the head articulates, it has two demifacets. So each one of the heads, it has superior demifacet and inferior. The inferior one is for the corresponding, because each rib articulates with the corresponding vertebra and the vertebra above. So I have the inferior one with the corresponding, the superior one for the vertebra above, all right? And then the tubercle articulates with the transverse process of the thoracic vertebra. All right, now this is regarding the typical ones, okay? Now let's look at the ribs and talk about the atypicals. So again, talking about the ribs, how would we know the typical ones? We need to add number 1 to our magic number, which is 28. So it's rib number 3 to 9, all right? So rib 3 to 9 are the typical ones. What do we mean by typical? We mean that we have head, we have neck, we have tubercle, we have an angle, we have shaft, and a cup for the costal cartilage. The head articulates with the vertebral body. The tubercle articulates with the transverse process of the thoracic vertebra. And the costal cup articulates with the costal cartilage, and that with the sternum anteriorly. This is any typical rib. However, we have atypical ones. Let's try to understand why we have atypical ones. Now let's talk about the thoracic vertebrae first. Knowing the general idea of the ribs and vertebrae, now think about it. Again, this magic sentence, each rib articulates with the corresponding vertebra and the vertebra above. It means that rib number 1 If it wants to articulate with a vertebra above, it needs T0, and we don't have any vertebra above T1. So in that case, vertebra number one, the thoracic vertebra number one, is going to be atypical. Why? Because generally we know that we have demifacet and demifacet for the rib and the one above. Now, for T1, rib number one, it does not have T0 to articulate with it. So it's going to have a complete facet on the vertebra itself. So why T1 is different? Because we have a complete costal facet on the vertebral body for rib number one. We don't have demi and demi. All right, so now we know why T1 is different. What about T9 to T12? Let's take it down to up. You guys know that our reps number 12 and 11, they are floating reps. And because they want to be floating, it means that they want to have least amount of connection with everything around them. First of all, they don't have costal cups because they don't articulate already with the sternum. Okay, so we understand that point. What about posteriorly? We also don't want to have firm attachment to the thoracic spine. So I don't have tubercle on the ribs, and I don't articulate with the transverse processes. All right. I also don't want firm attachment with the vertebra above. So all I want is to attach my rib to the corresponding thoracic vertebra. That's all I want. That will end up giving you guys that the costal facet for the vertebral body, first of all, is going to go back towards the pedicle because it wants to make up for the idea that we don't have two facets, demifacets, and it wants to make up for the idea that the rib cannot articulate with the transverse process. So it's pushed back at the pedicle. So T12, T11, and T10, because these are floating reps and because rep number 10 is going to follow them, they are not going to have demifacet and demifacet. It's only one complete facet on the body. It's actually not on the body, it's pushed back at the pedicle because they don't articulate with the transverse process because they need to have least amount of connection with the vertebral column. So we have only complete facet on the pedicles. We don't have transverse costal facets on the transverse processes. But for T10, we do have a transverse costal facet because T10 is not a floating rep. But why we consider it as atypical? It's atypical because number 11 does not want to articulate with it. So we don't have a demifacet for rep number 11. So it has a complete facet. All right. Why number 10 is atypical? This is just because it looks different, and it sometimes follows number 10 in the idea that it has its facet joints are different, and sometimes the rep would articulate with it without articulation with number 10. So that's why sometimes they consider T9 as typical and sometimes they would consider it as atypical. And the reason why is because rep number 10 is sometimes acting like 11 and 12, but sometimes it's not. So generally it would be like them, but in most of the books you will find it considered as atypical. So now you guys understand why these are atypical ones, because we don't have superior and inferior demifacets. We don't have for T12 and 11 transverse costal facets because they are floating reps. They are articulating with a floating reps. And 10 is affected by this idea. So that's why, because it doesn't have inferior demifacet, because 11 rep number 11 does not want to articulate with T10 vertebra, but it has transverse costal facet because this is rep number 10 is not a floating rep, and T9 is sometimes considered to be atypical, and we know now why T1 is like them, and we know what is the general features of the T2 to T8 thoracic vertebrae. It's the magical number 28. Now, why the reps we have typical and atypical? You guys by now know the typical rep. How does it look like? Why do we consider the first two and the last two as atypical? It's quite simple and easy. First thing is If you think about rib number 1 and 2, they have superior and inferior surfaces. Okay, they don't have anterior and posterior. So it has a flat superior and inferior surfaces, anterior and posterior borders. However, for the typical rib, we have anterior and posterior flat surfaces. Why? Because your lungs are here. You don't want the border to bother it. So we cannot follow rib number 1 and 2 in the rest of the typical ribs. So typical ribs, they have anterior and posterior surfaces. However, rib number 1 and 2, they have superior and inferior surfaces. Another thing is, think about rib number 1. What is the bone that lies superior to rib number 1? It's your clavicle. What does that mean? You have subclavian vessels. They are running below the clavicle, the subclavian vessels. I have subclavian vein, I have subclavian artery. In most of our body, veins are always, most of the time, anteriorly. So if this is the part that's going to articulate with the sternum, it means this is the anterior part um, of my rib. So if I have impression on the top of the first rib, that will be for the subclavian vein and followed by subclavian artery. And in between them, I have a tubercle for the attachment of the scalenus anterior muscle. So the scalenus anterior muscle comes all the way from the cervical spine, and it get attached to the first rib, all right, at the scalene tubercle, and this is what separates the impression of the subclavian vein and subclavian artery, all right. Now, what about second rib? Second rib is having the same idea. It has superior and inferior surfaces, but it's longer, twice the length of the first rib. And what makes it different and atypical is it has a tuberosity of serratus anterior muscle. Okay, so here we have S and S. We have tubercle for S muscles, scalenus anterior muscle, and serratus anterior muscle. Okay, so that's what makes rib number 1 and 2 atypical. What about 11 and 12? They are floating ribs. They are very short lips. They don't have tubercles. They don't because you guys know that they don't articulate with the transverse processes of the vertebral spine, right? So we don't have tubercles. We don't have costal cups. They don't articulate with the costal cartilages. They are floating ribs. They are shorter. They are smaller. So everything is different, all right? So we don't get to see even the costal angle, the tubercle and the neck. Okay, so many things. They do have an angle, of course, because that takes me to the shaft, but they don't have the tubercles. They don't have the costal cups, and they are shorter. They are floating. That's why rib number 11 and 12 are considered as atypical. And again, we would consider the one before them as atypical, the same idea of the thoracic vertebrae. We know that it's 12 and 11 and 10, and sometimes we consider 9 as an atypical because it would follow the following ribs. Okay, so the atypical ones are 1 and 2, and the last three, number 3 to 9, we will add 1 to the atypical vertebrae, which was the magic number. Our magic number was 28. 2 to 8 are typical. Before that and after that are atypical. 3 to 9 in terms of ribs are typical. Before that and after that are considered atypical, and now we know why. That was a drawing that I drew it earlier as a summary of what we just said. It was talking about the thoracic vertebrae. We had typical and atypical, the magic number 2 to 8. Why they are typical? Because they have superior and inferior demifacets, and it has the transverse costal facet on the transverse process, and that articulates with the tubercle of the rib, and the demifacets of the body articulate with the head, superior and inferior demifacets of the head of the typical ribs. And then we have the atypical ones, the last two, because it's a floating rib. They don't articulate with the transverse processes, so we don't have transverse costal facets. They also don't attach to the vertebra above, so we have complete costal facets on their corresponding vertebral thoracic vertebrae. They don't have demifacets. And the same idea is here at T10, but it has a transverse costal facet because it's not a floating rib. It has a complete facet because rib number 11 does not want to articulate with it. T1, why is it considered as atypical? Because rib number 1, it has a complete facet because, again, I don't have something above me to articulate with, so I need to have a complete facet for the rib number 1 to get attached fully into it, and then I have a demi-facet for the next rib. All right, if you look at the ribs, you have the atypical and atypical, and the typical. So typical, we would add number 1 to this magic number, 3 to 9, and why 1 and 2 are atypical. We talked about that as the impression of the subclavian vessels for number 1 and the tuberosity for scalenus anterior. And we talked about the tuberosity of serratus anterior for rib number 2. And the last two are actually floating ribs. And for rib number 12, we don't have neck, but 11 we do have. No, both of them they don't have. We have angles. All right, so rib number 11 and 12, we don't have costal cup because they are floating. We don't have tubercle because we don't articulate with the transverse process. And here that was a summary about the true ribs from 1 to 7 because they articulate with the sternum with their own costal cartilages. 8 to 10, they indirectly attach, so they are false. And these are the last two, which are the floating ribs. Okay, so I hope you guys can use this summary to study your idea later on.